We are live. Hello, Dr. John. We're live.
Good morning, Jannis, and welcome everybody to Outside the Box 2020 with Jannis Paulk from Clarity Based Marketing and Dr. John Rothwell, Advanced Practice Registered Nurse with Island Direct Primary Care. Glad to have everybody here today.
Yeah.
How was that?
It was nice. That was nice. I was just like, wow, it sounds great. Maybe you should just come along with me wherever I go and just introduce me when I walk in the door. How's that?
Right? As long as I don't start it off with welcome to the stage, Miss Janet. Oh.
I don't know. I'm okay with that. I'm okay. You can do that. Yeah. We'll be walking in. People will say, who is this guy? Oh, he's my announcer. He's my announcer. He announces me.
I'm your John.
Yeah. Very nice. Very nice. Okay. So
what are we talking about today?
Go right into our conversation. So the subject today, I'm trying to focus in. And so the subject today is 2 things to know about leaky gut syndrome. Because I just have to say, the whole leaky gut syndrome and, all the gut stuff, I know gut stuff is important, but I also am kind of skeptical in that it feels like.
Still?
You know me, right? You know me. And no, yes and no. Because I feel like everything gets blamed on that. And so sometimes I feel like it's kind of a scapegoaty kind of thing. Back in the day when everybody's kids got their tonsils out and everybody's kids got tubes in their ears. And now it's like everybody has leaky gut syndrome. And, I'm skeptical. It's what I do.
Yeah. Well, look, it's important. And I always encourage, everybody knows you're a patient, and I encourage all my other patients to ask questions. And it's important to question. Look, if you can't question and your provider's not listening to you, then it's overwhelming, right? And so you should be finding a provider that you can question and ask those questions to, and look, just be just as open to listen too. And so it's a relationship.
Yeah, absolutely. And I am open to listen. So that being said, let's start with the first thing. The first thing.
Did you know that anti-inflammatories cause leaky gut?
Okay. Stop right there. Anti-inflammatories
may cause leaky gut.
All right. So define what an anti-inflammatory is.
So why don't we define first what leaky gut is?
Okay.
And so leaky gut is when bacteria and other toxins get into the bloodstream through the gut. And so if we were to decide, what's the gut, right? Is the stomach the gut? Do you know what the gut is?
I never really thought about it.
Yeah.
To be honest with you.
Punched in the gut.
Mm-hmm. It's like your stomach area.
Your stomach area, right? Okay. So your gut is your small intestines and your large intestines.
Okay. And so it's like the whole thing.
The whole kit and caboodle. And so most of your nutrients are absorbed in the gut. Your food's broken down in the stomach. And then it goes from the stomach into your small intestines. Your small intestines takes all the vitamins and minerals and all the good stuff that your body needs and puts it into the bloodstream, and so it can get into your cells. And then
stop. Okay, so you eat your food, it goes down into your stomach. There.
Yep.
Then right below that, mouth,
esophagus.
Stomach. Okay, mouth, esophagus.
Stomach.
Which is right there at the bottom of your rib cage, right?
Yeah.
Have a little anatomy lesson here.
Yep.
And
small intestine.
Small intestine. Okay.
Large intestine.
Okay.
And then your rectum and anus makes up the end of your digestive system. Okay. And so when you eat and drink, your body goes through a process.
Okay. All right. So this is a little off, but not really. So when your food hits your stomach, what's your stomach doing?
So you have 2 things, and everyone thinks that they have indigestion and they need an antacid and they have increased acid, which is what's causing reflux and those kind of things.
Very common, very common, very common.
Very common thought.
Okay.
What's just as uncommon is low acid versus high acid. And most providers, actually, I can't say most providers because that's not really doctorate level speaking, but let's say most of us experience the take omeprazole, take Pepsid, take some kind of acid reducer.
Yep.
Because because the reflux.
Right.
And reality is we very, very rarely check for decreased acid. And so we take something and we reduce acid when someone who actually already has a reduced acid. And
right there is why all medicines say talk to your doctor before taking this medicine.
That's one of the good reasons. Yeah.
Yeah.
And so your stomach
that.
has a lid on the top and it has a lid in the bottom, so it can break things down with acid, if you will. And then from there, it goes into the small intestine. And so the small intestine is where leaky gut occurs.
Okay. All right.
And the reason why it occurs there is that's where all your nutrients are absorbed and gets into the bloodstream. And the way it's done that, there's a very thin, what we call a thin epithelial lining. So just think a thin layer of skin there. So things in the small intestine, and there's these little channels that go from the small intestine into the main body, into the bloodstream and stuff, so that we can transport the nutrients that we need.
Okay.
What happens is that if you have certain things like toxins, like metals, you have certain things like allergens, like in many cases, lactose or dairy.
Okay. I know a little something about that.
You know a little something about that.
I do.
Or, even allergens, toxins, and then medications. And so what happens is that these things cause the channels to be disrupted in the small intestines. And so then when they disrupt, they get little micro breaks in that lining that I was talking about.
Okay.
Of the small intestine.
I think I'm following you.
Yeah. And what is in our gut predominantly? What breaks down all that stuff?
Bacteria.
Woo!
See, I'm a good student. I can.
That's right. And so now that you have these small channels going from your small intestine into your bloodstream, or what else is going there?
I don't know. I missed that class.
The bacteria.
Oh, okay. Okay.
Yeah, because now you have these. Now you have these holes.
Okay.
Now you have these holes.
Okay.
Right. And so since you have these holes in there, bacteria. We have trillions of bacteria.
Good ones and bad ones.
Good ones and bad ones. That's right. And so guess what goes in the body when you have these little holes in the gut? Good ones and bad ones. Yeah. And they become off balance.
Okay.
So when a provider or someone suggests a probiotic, that is to create balance in the gut.
Right.
One of the things we often miss, though, is that the gut still needs to heal. We need to shut those channels down, those bad ones. Because when we don't, the gut becomes inflamed. Inflammation is a response to a foreign body. Well, if your bacteria is not supposed to be there, or the allergen's not supposed to be there because it's leaked out, the body has an inflammatory response to protect it.
Okay.
You see what I'm saying?
Yes.
Okay. And so
an anti-inflammatory would.
So a non-steroidal anti-inflammatory, so ibuprofen or Aleve, these kind of things. What's one of the main things that providers tell you to do before you take that medicine?
Talk to your doctor. I don't know. I don't know.
Take it with food.
Okay.
Right. And why?
Last two. Take it with food. I don't know why. I don't know.
Because it upsets your stomach.
Okay.
And it upsets your gut. And so because it does that, then what happens is when you take too much of this stuff, like too much ibuprofen or Aleve, then it does exactly what you don't want to do. You're taking it to reduce inflammation, right? And here you are taking it, and because you're not taking it the right way, or you take too much of it, the body's responding to it with inflammation.
Okay, so if you're watching this, did you know that? I'm just curious if anybody weighs in to say, whether they knew these things or not, because I didn't. I really didn't think, I kind of have that like little know-it-all vibe about me, as we both know. Sometimes, but I do know that I don't even know what I don't know. So some of these things that you're saying, I never thought about. I know that there are a lot of medicines that they say take with food, and and I generally do, because if I don't, I regret it. I never really thought about the why, behind it, and what it could potentially be doing.
And that's just a small example, but again, with like dairy, we're the only mammal that consumes dairy after being breastfed.
Okay.
And it takes generations for evolution to occur. And so there's a small population in Northern Europe that 95% of that population can tolerate dairy. Outside of that, many people have a dairy sensitivity, an intolerance, or an allergen, and they're not all the same. But at the end of the day, it just takes a small amount to cause an inflammatory response.
Yeah.
Right.
And I'll tell you that I'm finding the older I get and the more, I guess, out of whack my gut is, the more things I'm sensitive to. Like, for example, I must sadly report that apparently my body has decided that delicious ribs are no longer my friend. So I love ribs so much, and I've had them a couple of times in the last couple of weeks, and it's like almost immediate response now, and it's very similar to what dairy does to me. So whatever's happened in my stomach.
So can I ask you a question?
Yeah, sure.
Did you have plain ribs?
Once I did, and once
Now, when I say plain ribs, I mean nothing but salt and pepper on them.
Oh, I mean, I don't know. The first ones were dry. They did not seem to have any kind of like a dry rub, but they probably did.
Did they
probably
have sauce?
There was no sauce on the first one.
Okay, so then they had to have some kind of flavor. Nobody cooks a rib without flavor.
Right. That's right. It wasn't real heavy though. It was like I didn't really notice any.
And so if it was a blend,
yeah,
it could have had MSG.
Yeah.
It could have had some kind of artificial color or artificial or sweetener or brown sugar, or I can keep going on, right?
I know.
I mean, I'm a barbecuer. I mean, I'm a Carolina boy, and I
love barbecue
outside, right? So one is you got to look at those things. So that's why when people work with us at Island Direct Primary Care, we often talk about an anti-inflammatory protocol when it comes to nutrition. And we want to eliminate these things that could potentially cause an inflammatory response. And so we kind of go through the whole 30 approach. Looks a little like keto, acts more like paleo if people are disciplined enough, or they have enough I'm ready to go for it type attitude, and they do it. And so when we eliminate all that stuff, then when we start reintroducing it back, that's really when we find out. So for me, for example, I did it because of my spouse and her autoimmunity. And so what I found was if I eat Chinese food, I have to be careful what kind of Chinese food that I eat now because of the MSG and the food colorings and that kind of thing. My body actually responds negatively to it. Doesn't mean I'm allergic. It just means that I'm sensitive.
So let me ask you this though. So going, back to the leaky gut, syndrome. Like I said, I'm skeptical as to whether as many people who claim to have leaky gut or really do. Like, I mean, what do you have leaky gut? I mean, how do you know, first of all?
Well, I just told you, right? So
okay.
I respond negatively when I eat certain things.
So does that indicate that you have
that
leaky gut
it indicates
syndrome?
that I have some kind of inflammation.
Okay.
It causes like bloating, gas,
right.
flatulence and all that stuff.
Mm-hmm.
Those are some symptoms of what you would get in a leaky gut type scenario. Okay. And so where your gut is off of balance doesn't necessarily mean that you have all these. Look, I don't want to scare anybody. You're not having all these toxins and bacteria just pouring into your body, right?
Right.
There's a way to make this better, and that is, a good multi-strand probiotic. If you're a woman and yeast is very uncommon, you need to make sure it's a different kind of probiotic, and then you need to meet the right amino acids to heal that lining. And so then what happens is you heal the lining. You might eat some of these things on your cheat day because, look, everyone wants to have a little cheat every once in a while, right?
Yeah,
and
absolutely.
So you have your cheat day, and then your belly's all bloated up. You got gas, whatever. You don't feel good. You're just uncomfortable. And does that mean you're going to have leaky gut again right away? No, it doesn't. It just means that, don't do it again. You need to wait a little while and let your body kind of absorb and do its thing and let things pass the natural way. So it's one of the reasons why I take a probiotic on it every day. My wife is on 2 different probiotics and an amino acid every day to make sure that the integrity of her gut stays healthy, because she has autoimmunity. So she, an autoimmune disorder. And so to make sure that she maintains the integrity of her gut, we have her on her probiotics, 2 different ones. So.
Okay. So, all right. So let me ask you this, on one thing. So we're gonna wrap up with 2 important things about leaky gut. One that I want to wrap up with is what's the best way to determine that you have leaky gut? Is it by assessing symptoms, or is there some kind of test? It short. Make that a short answer.
there is no short answer to it, but okay. I'll try. All right.
Okay.
1, find you a practitioner that's willing to order the appropriate testing. If you go with functional medicine tests with gut health, I tend to find that those are a little bit more reliable and specific.
Okay.
But they're not very cost effective. Okay. So they're high cost. My initial way of doing these kind of things is I like to go through the elimination diet. I like to determine how long it takes your body to, what's the transition time when you eat. So, I like to use red beets for an example.
Stop. That's the second one I was going to answer.
Yeah.
Stop. Don't go there yet. Because I'm gonna have you explain that. I love that so much.
So that's it. So elimination diet's one way to do it. You eliminate for 30 days, and then you introduce one thing every 72, the same thing for a couple times that in the same week to see if your body responds. If your body responds positive, then you can have it occasionally. If your body responds negative, then to pull back, or at least your consequences. And so I think that's the most cost-effective way to do it versus a $500 stool test. So.
Okay, so let's wrap with number 2, which was I wanted you to tell everyone that a very tangible, free way to kind of assess what your body's doing with the beets. I thought that was fascinating. So this is a free test. You can do this at home, and
it's $3.99 at Publix. and
Okay.
you can pick it up in the produce section.
Okay.
And they're red beets, right?
Okay.
And
Yeah.
so red beets are extremely healthy. You want fresh beets, not the ones that have already been cleaned in a Ziploc bag or whatever. Get fresh red beets and cut off your greens. Save those for a salad. Wash your beets. Then take coconut oil and rub them with coconut oil. Wrap them in aluminum foil. Bake them in the oven until they're kind of, you can kind of like a baked potato, where you can kind of push into them where they're somewhat soft but have some firmness to them. And take those out and slice them up and eat them, right? And you eat them with a salad or eat them as a side, whatever the case may be. And then watch your urine and your stool. And they will often have a red or pink hue to them. And so interesting enough, this happened to me and I didn't realize it one time and I got scared. And so I did the Dr. Google thing. And then as I'm going through and then I start doing some more reading and lo and behold, beets can do that. And it shouldn't surprise me because asparagus makes my urine smell. And so anyways, you watch to see how long it takes your urine and your stool to clear up from after eating beets. And that kind of gives you the transition time or the transfer time of food in and out of your body. And so you should have a bowel movement 2 to 3 times a day. That's normal. So having a bowel movement once a day, having a bowel movement once every other day and stuff like that, that is not normal. And so even though we like to say, well, what's your normal? Well, I normally go twice a week. Yeah, that's not normal. That means you're holding all the yucky stuff in.
So what is the general time that, range that would be normal, so to speak, for processing through the beets?
Well, I would say within 24 hours.
Okay.
24 to 48 hours is what I find kind of routinely. I mean, everything, you don't know exactly how much is being absorbed and going out and stuff, but it kind of gives you an idea. I remember the first time I did it and I was new to my anti-inflammatory diet. It took me about 4 days. And now it's about a day and a half or so.
Okay.
And it just it's going to depend on how healthy your gut is.
That's right. Well, that's very good. So it's a huge subject, like every subject we talk about. So we're going to clip it there. We got those 2 things. One way you can kind of test yourself and whether you need clinical testing or just symptom analysis in order to figure it out. So we'll talk about this subject again in the future. We could probably talk about acid reflux because I think like 4 out of 5 people have acid reflux, and it's kind of connected too. So
it's all interconnected.
I used to medicate for acid reflux years ago, and I stopped. I just stopped, and actually stopping the medication made me better. So
it goes exactly with what I told our friend Nola. I go, I bet you Jannis actually has less acid than she needs versus too much acid.
Yeah, I don't have acid reflux issues much. Once in a blue moon I will, but I really do not. I used to.
We generalize it, call it acid reflux, but in many cases it's a reduced acid versus a increased acid. So, and we can talk about that next time.
That's right. We'll do that.
Next week, I am on my way to Saranac Lake and Lake Placid. I'm going to play rugby, and I'm going to up there with my old breed military brothers, and so we play for Gold Star families. So we play in remembrance of our fallen brothers and sisters, people who pay the ultimate sacrifice for our country, and it's one of our philanthropy events, and so it's the largest rugby tournament in North America, and so we'll be up there for 4 days playing rugby and bonding and having our memorial service and that kind of thing. So we just lost one of our brothers on 4th of July. So it's going to be, it'll be an emotional time. It always is. And Dr. John, nurse practitioner, actually is getting inducted into the Rugby Hall of Fame, and so that's
Very good. Congratulations.
Kind of
So
cool.
I won't see you next week.
Nope.
So we'll be back the following week.
We'll be back the following week.
Very good. Well, we'll
All
schedule a talk for that. Enjoy your trip. And
Awesome.
Thanks as always. And if you're watching and you have questions, go ahead and post the questions. Dr. John's very good about coming back and answering.
Awesome. Take care, everybody. Bye-bye.
Have a good one.